Good evening. Good evening.
Yes.
I'm going. Welcome to my class. But before
Yes, madam.
I'm going to call
Yeah.
the register.
Yes.
Alice Kiplangat.
Yeah, we are in the class.
Chepkemoi Sheila.
Endelea.
Diana Ogera. Today we are going to learn about performing. Today we are going to learn about performing dietetics operation, and after that we are going to look at terminologies applied in burns, surgery and trauma. By the end of the lesson, you should be able to define the terms applied in surgery, trauma and burns. Also, you'll be able to describe the pathophysiology of burns and their nutrition management. You should be also able to explain the surgery nutrition implications and management. Then we are going to define some terms. Burns refers to injuries that result from exposure of heat, electricity, chemicals, radiation, or any other source of energy causing damage on the skin. Then we have the surgery, refers to branch of medicine that involve cutting, removal, and closure of body tissues with an aim of treating an injury, disease, or a disorder. Then we have the trauma, refers to deeply distressing or disturbing experience that may cause physical, emotional, or psychological harm. It can result from the various events or situations that are overwhelming. Then we move to pathophysiology of burns. This refers to the complex process that involves all the major organ system. The severity of burns depends on the depth of the burn's total body surface area. This pathophysiology of burns is divided into 4 phases. The first phase, we have the acute phase. This begins immediately after the burns and lasts for several days. During this phase, the body is focused on maintaining homeostasis and preventing infections. The body responds to the burn injuries by releasing a number of inflammatory mediators such as cytokines, chemokines, and histamines. Then we are going to move to the second phase. The phase occurs between 24 to 48 hours after the burn injury and is characterized by hypovolemia due to fluid loss and into the burned wound. Fluid loss occurs due to increased vascular permeability and proteins denaturation. Hypovolemia can lead to shock, which can be fatal if not treated promptly. During this phase, the body attempts to conserve energy and maintain blood flow to vital organs. This is done by decreasing the blood flow to peripheral tissues such as the skin and the muscles. Are we together? Yes, class, are we together?
Yes, we are together.
Now we are going to move to the third phase, which is the flow phase. The flow phase occurs between 48 to 72 hours after the burn injury and is characterized by hypovolemia due to fluid shifts from the intracellular to extracellular space. During the flow phase, the body metabolism increases significantly due to some factors. These factors include increased tissue repair, increased inflammation, increased protein breakdown, increased heart rate and pressure. Then we are going to the fourth phase, which is recovery phase. This phase begins several days after the burn injury and lasts for several weeks or months. During this phase, the body begins to repair the damaged tissue. New skin cells are produced and the burn wounds heals. Then we have the nutritional management of burns. You eat plenty of calories to prevent the bodies to help their bodies heal. You eat plenty of protein for tissue repair. Like, for example, the legumes, meat, poultry, and fish. Then you eat plenty of carbohydrates to provide energy for the body. For example, the fruits, vegetables, the whole grains, and starchy vegetables. Eat plenty of fluids. People with burns are at risk of dehydration, so it is important to drink plenty of fluids. Aim to drink between 8 to 10 glasses of water per day. Then you eat plenty of vitamins and minerals essential for overall health and healing. Then we have the surgery nutrition implications. The first one, you have reduced food intake. Patient may be unable to eat or drink normally before, during, and after surgery. Then you increase the metabolic rate. The body's metabolic rate increases after surgery to promote healing. This means that the body burns more calories even at rest. Then we also have the increased protein needs. The body needs more protein to repair tissues and build new muscles after surgery. Then we have the increased fluid needs. Patient may lose fluids during surgery and need to be rehydrated. Then we have the nutrition management of surgery. The nutrition management of surgery is to ensure that the patient receives the nutrients they need to heal and recover properly. The first one is oral nutrition. Most patients can receive oral feeding soon after the surgery. We also have enteral nutrition. Enteral nutrition is used for patients who are unable to eat food by mouth. Then we have the parenteral nutrition. This is used for patients who cannot absorb nutrients from the gut. Any question, class? Yes, class, any question? If there is no question, before we end our class, we want to do a recap of our class, and I want you to tell me whatever you have learned throughout the lesson. Anybody? Anybody, class?
Okay, I've learned about the nutrition management
Yes.
of burn patients.
Yes.
They need to take a lot of protein that will help them to repair tissues. Take plenty water
Yes.
to recover the. Thank you.
Thank you, Ogera. Anybody else? Maclean?
I've learned about nutrition management of surgery, whereby it helps to the nutrition management of surgery helps to ensure that patients receive the nutrients. Yes, that's what I've learned today.
Thank you, Maclean. Anybody else? Sheila? Chepkemoi? If there is no other question
About the recovery phase.
yes, what about the recovery phase? What happened at that phase?
In that phase, the tissues the body begins to repair.
Okay, that's nice. Anybody else? Thank you for your feedback, and before we end our lesson, I would like to give you an assignment. You explain the goals of nutrition management of surgery patients. Thank you, and I wish you all the best.
You too.
Bye.